Okay, so what we're aiming for is the early recognition of flu-like illness or an outbreak. We're looking for prompt control measures to be put in place, so your infection control measures to prevent further spread, early treatment and prophylaxis with antivirals medication if that is appropriate. Okay, so what will happen is that you may go into your home and you may find that on handover you've been told 3 residents are exhibiting signs of a flu-like illness. So what you'll do then, that looks like it's going to fit into criteria of an outbreak. So you phone the duty room, the public health duty room, and hopefully you'll have the information for that. And then what will happen is that we will complete a risk assessment. So we will be looking for demographic information. So we'll be looking for how many residents you do have in your entire home. What type of settings are they in? How many units, floors is your home made up with? Are they in single rooms, shared rooms, ensuite rooms, etc.? We then want to know the number of residents that are symptomatic and also the number of staff are symptomatic, because that will also help you with your management of the outbreak. Again, the symptom onset and what the first date of that person who has been symptomatic, to see if that actually meets the case definition. So this is the information that we gather. So when you phone us, this is what we're gathering whenever we're asking you these certain questions. So we'll need the name, the health and care number, the date of birth, and then the symptoms of what your resident is exhibiting. So is it a cough, nasal discharge, shortness of breath, or just a general decline? We'll look for that date of onset and we'll look for their location within the home. So what we're trying to establish as well is that, is there a cluster within one particular corridor or one particular unit, and will that help you in cohorting your staff and your residents as well? So this is our flu-like definition, okay, so this is what we work to. So whenever you're phoning us, you may have found, if some homes have phoned us last year in the last outbreak, is that we might have said, you aren't actually fitting the criteria for a flu-like illness. And that did happen a number of homes because it was a little bit vague, the actual symptoms, but there was still something going on within the home. So it may not have been, for example, a flu-like illness, but there was a respiratory illness going on within the home. So what we would have done is said, instead of declaring it as an outbreak, we would have said we would have monitored the situation and been able to provide still assistance in infection control and helping you throughout that particular outbreak or escalation. So that's what we look for. So that's our definition. So we look for temperatures, we look for coughs, sneezes. We also look for as well if they have been seen by their GP. So have they had a clinical diagnosis? Does it look like it is a bacterial or does it look like it's a viral infection? And again, that's important as well, giving us the clinical picture. So this is our risk assessment. So we're going to look to see if the flu definition has been met. We're going to look at the attack rate. We're going to also look at the spread. Have you managed to put in place early infection control measures? So have you been able to isolate the residents? Have you been able to reduce your visiting? So we're not saying closing to visiting, we're just saying reducing visiting, letting your visitors know that there's an outbreak of a respiratory illness within the home so they can make a choice whether or not they want to visit. And again, pointing out to the elderly visitors and those who may be pregnant that there is an increased risk to them, okay? So it's just looking at the entire picture. We're looking at the spread, so is it between, as I said earlier, in one corridor, has it spread throughout the home, is it on different floors? And just what stage are we at? Are we within a 48-hour window where we can look at antivirals? Can we then look at that or look at swabbing as well, okay? So they're all the things that we complete when you phone the duty room. So if we decide that there looks like a reasonable expectation that it is a viral illness like flu, we will ask for swabs to be done. We look for a maximum of 5 swabs in the 5 most recently affected residents. So that would be either a nose swab, and you have to get right up to the top and make sure you swab it there because that's where the virus is carried, or at the back of the throat. Again, it's just a dry swab, so for preparation purposes, if you gather those now, so usually if you're pre-armed you probably not need to use them, but if you have your swabs ready, at least you know that you can go and swab your residents. In the duty room, we'll do the contacting of the duty virologist. So we'll say that X home looks like it's a flu-like illness, and we will be sending swabs, and they will hopefully expedite them through. Again, we will alert you in the home over how you transport those swabs. So you may find that we may organise a taxi, and we'll taxi them to the Royal, or we may say just put them through the general collection with your GP. It is important when we will supply the documentation to go with those swabs, so it'll be your virology form, and that you label them correctly with the proper residence details. Okay. We'll also, when we're gathering our risk assessment, look at your vaccination policy, the number of residents that have been vaccinated, and also the number of staff that have been vaccinated as well. So, our infection control advice, we will go through this with each home, the phone in. Although this talk is about flu-like illness, this also is relevant for D&V outbreaks as well, okay? So that is isolation, hand hygiene with soap and water, the appropriate use of your PPEs, your environmental and equipment decontamination, so that would be your hoists and things, your waste management, that you have enough yellow bags and red laundry bags as well. So, and that your laundry hasn't got any problems with machines down, especially if you're in the middle of an outbreak. So what we would say is to isolate your affected resident in a single room, risk assess any transfers to the facilities. So this changed last year. We probably had previously said that you were closed to any new transfers in and new admissions. We have changed that policy last year because of the impact of discharging residents from hospitals. So what we say now is that it will be a risk assessment between yourselves and the trust over whether or not a patient can go to the home as a resident. Again, if that is the case, we'll ask you to terminally clean the empty room, so that patient will then move into that room, and then you reverse barrier nurse them to protect them against whatever is in the environment. We would ask you to cohort your staff so that there's no crossover, that they look after the symptomatic residents or asymptomatic residents. That the advice for banking agency staff is that we would advise that they wouldn't be able to work in different homes during that outbreak. Again, the restricting visiting is just for those high-risk groups and also for people to make an informed choice if they wish to visit. If they do wish to visit, that you make sure that there is hand hygiene points, and that would be a designated toilet with soap and water where they can wash their hands, and that you also put up your alert signage as well. We would also ask for your environmental cleaning, so we will be looking for an outbreak cleaning product, as you probably, some of you already know from us, which has got to be chlorine releasing, so chlorine releasing chlorine dioxide. We will ask that when we're completing our risk assessment, because it's important that the cleaning is done to the proper standard in order to reduce and minimise the spread within the home. So if somebody is phoning us with an outbreak, that they have to hand what cleaning product they use, so that we can advise on the appropriate use of that. So for example, does it need a disinfectant pre-wash before the chlorine wash, and the contact times that are required as well. Again, looking at decontaminating your equipment, so your single use, if more appropriate and if you can, but also to remember, especially in flu-like illness, nebulizer masks need cleaned after each use as well. Again, as I mentioned, your waste management, so making sure that you have enough yellow bags and that you have frequent waste collection, and that your laundry can cope with your red bags that are going through it as well. So your PPEs. And it is appropriate use of PPEs, so whenever you have an outbreak within the home, is that you gown up, you go into the room, you carry out your care, you remove your PPE, wash your hands with soap and water, and you leave the room. And it's not walking up and down corridors with aprons and gloves on because you've forgotten to get wipes, or somebody's left the laundry skip, or there's no red bags or yellow bags. So it's that preparation before you go into the room to make sure that you have everything that you need. Again, respiratory etiquette is really important, so encouraging residents to use disposable tissues. You catch it, you bin it, you kill it. So putting bins with yellow bags around, for example, in their rooms, so they have easy access to be able to do that. Again, making sure that your hand hygiene posters are up and that people are, staff and residents and your visitors as well, are all adhering to hand hygiene. So after, if your resident has been symptomatic with respiratory etiquette, so they've binned it, you offer them the opportunity to wash their hands, that staff are adhering to the 7 steps, and that you're auditing this, so that you, in an outbreak situation, you may do, for example, your hand hygiene audits on a 2-weekly, monthly basis as normal, and the scores are satisfactory. But during an outbreak, we would recommend that you do them on a daily basis so you can see what's going on within the home. Again, when you're doing your hand hygiene audits, even in the build-up to the season starting, and there's any identification of any learning, that is addressed now rather than waiting until. So any clinical supervision sessions that you can address any learning needs. Okay, so what we would also ask you to do is communicate with us in the duty room. So you've phoned in and you've told us there's an outbreak, and we have said, yes, you have an outbreak of a respiratory illness. We have done the swabs, so we're waiting on results back to say whether or not it's a confirmed flu or RSV, or whether or not it's just a respiratory, increase in respiratory illness. We would ask that a daily update, which would be in a pack that we send out whenever the outbreak is declared, is returned to the duty room by 12 noon. Now, you probably, if some of you may remember from this year in January, we were dealing with about 30 homes at one stage having an outbreak, so there was a large volume of information that we needed to gather. So we were probably starting to phone homes around 9:30 in the morning to get updates, but we would still need that daily update to come in to make sure there was no changes. The reason why we look for that daily update is that we then compile all that information and we send it out trust-wide to all the trusts in about 2 o'clock, 3 o'clock in the afternoon. So that means that they know exactly what homes are at what stage and are having an outbreak of what in particular, DNV or flu. That means that goes to the bed managers, it goes to the ED departments, so everybody knows what's happening in your home. So are you still active? Are you waiting to start your terminal clean, or are you cleaning? And that gives them an indication of where you are, so you can be able to accept residents back. So that's why we look for that information. We will provide you the information of the swabs. So if you've submitted swabs or you've submitted other samples, we will check those and we will phone the home and say if they're positive for a particular organism. We will also alert the Trust Infection Control Team if, for example, you have a resident that is in hospital or is en route to hospital. But we would also ask that if you are transferring someone to hospital because they're unwell due to your outbreak, that you alert NIAS to that. So be it DNV or flu-like illness, when you're making the call, that you say that the home is currently experiencing an outbreak. We will be putting email guidance up, and we'll actually be emailing every home as we've done last year and the year before in relation to preparing yourselves for the flu. So that'll be your outbreak pack will be included in that, hand hygiene and how to identify any flu illness within your home. We would also ask for you to liaise with your GP so that they also have an overall picture of the clinical picture, and then we know what they think also is going on within the home. Terminally cleaning. If you have an outbreak of DNV, what we'll ask you to do is terminally clean after 48 hours after your last symptomatic resident, okay? So that is for DNV. For flu-like illness, what we'll ask is that it should be commenced the date 5 days from the date of the last onset. So that's why it's important that we have up-to-date information in the daily updates coming into us every day, who's been symptomatic and what their onset date and time is. Even if it's overnight, then it allows us to be able to tell you when you can start your terminal clean. Now, with a DNV outbreak, you have to have asymptomatic residents, so everybody has to have been recovered by the time you start your terminal clean. It's a little different with flu-like illness in that as long as it's 5 days after the onset, you can start your terminal clean, even if you have some residents who are still a bit sniffly or coughing. They are no longer in the infectious period, and that's why you can start your terminal clean. The terminal clean advice will be in the outbreak pack, but we will talk you through it whenever you're at that stage. and it'll be the entire home that needs to be cleaned. So even though it was one unit or one corridor that might have been affected, we will advise you to clean the entire home because of foot traffic through it. So staff moving around, food trolleys, laundry skips can all be carriage for the organism to make their way through the home. So that's why we say the entire home needs to be cleaned with your outbreak cleaning product, steaming your carpets, your fabric chairs, and also taking your curtains down and laundering them. So it can be a big undertaking, but it's really important to be done properly to prevent any relapses. If we can't get the organism out of the environment, then you're probably looking at a relapse further down the line. So it's really important that that part is done well. Whenever you've completed your terminal clean, we will ask you to submit a summary report. That's in the outbreak pack, and that will give us an overview of everything what has happened within the home. So that will be how many residents were affected, how many staff affected, how many residents hospitalised, if there were any deaths, and then we can say, we put all that information on our system, and then we can say that that particular outbreak is now at an end. Antiviral medication. Now, this is really, the objective for using antiviral medication is to impact the effect on the resident, so that they hopefully won't become so sick that they need to really go into hospital. And the use of antivirals within a care home setting has been recommended by NICE. Again, it is a clinical decision. Okay, sorry. So, there is some evidence to inform recommendations for the use of antivirals for treatment and prophylaxis in care home settings, although it is acknowledged that clinicians will consider these in relation to each individual situation using their own clinical judgment. So even though we may say to you, flu is circulating in the community because we know that from our surveillance information, we know that from the volume of homes coming in, we know that from the positive flu swabs that we're getting, it's still up to the GP whether or not they wish to prescribe antivirals for their particular residents. So what we'll do is we will send a letter to the home that will be for the GP practices requesting that they consider antiviral medication. Now that can be at the start of the season if your home is actually positive for the flu, or what happened in the last flu season is that there was so much homes coming in, it was the sheer volume, and we knew that it was circulating at very high levels in the community, that we made the judgment that it's more than likely to be flu. So we actually didn't wait on any swab results, we just put the letter out saying that we would ask for antivirals to be considered. So during out of hours, these requests for antivirals are made through your out of hours primary care providers, and I know there can be difficulties with GPs and the volume of work that this can bring about. So it was brought about last year and it's going to be rolled out again this year. So because we know that there will be an increased workload for GPs, we recognise that the final decision whether or not to prescribe the antivirals is the GP's clinical decision. And also the antivirals need to be prescribed within a 48-hour window to have any effect in lessening the symptoms of flu-like illness. We have developed a LES. So a LES is a local enhanced service which we put in place last year for GPs. Now, we did have some GPs phone us saying that they didn't want to subscribe to the LES, or they hadn't subscribed to the LES. What could they do? If they didn't want to subscribe to LES, that was their own choice to do that. And if they still wanted to prescribe using LES, they could still prescribe at that time and just submit the claim forms afterwards. It really is just a way of financially acknowledging the GP input. So you may find that some GPs still will be reluctant to prescribe antivirals, and some may use the LES system. It's really just a bit hit and miss, but it will be rolled out again this year in order to try to encourage the prescribing of antivirals. So that was a quick run through of how we manage an outbreak in a care home.